Good evening. My name is Kathy Poole, and I'm the Director of Marketing and Community Relations for Nashville General Hospital. Today is National Women's Physicians Day, which is commemorated annually on the birthday of Elizabeth Blackwell, who became the first female clinician in the United States in 1849. We also want to recognize Dr. Rebecca Lee Crumpler, who became the first female African-American physician in 1864. Here we are over 150 years later, and women make up 1/3 of all physicians. To celebrate Drs. Blackwell and Crumpler and all past, present, and future female physicians, we are hosting a Women in Medicine Roundtable discussion with a few of our own. Our goal is to learn about their personal journeys on becoming physicians, any challenges they face to get here, and advice to the next generation of female doctors. Joining us this evening are Dr. Deanne Bullock, Chief Medical Officer and Medical Director of Emergency Services at Nashville General Hospital, Dr. Monica Davis, Family Medicine Physician with the Nashville Healthcare Center, Dr. Marquetta Faulkner, Chief of Nephrology at Nashville General Hospital and Meharry Medical College, Dr. Tara Long, Medical Director and Family Medicine Physician at the Nashville Healthcare Center, Dr. Noella Tamufor, Internal Medicine Chief Resident at Meharry Medical College, who is also enrolled part-time at Johns Hopkins University to obtain her master's in public health. And last, but certainly not least, please welcome our Women in Medicine Roundtable moderator, Ms. Kaylin Harris.
Thank you, Kathy. Hello, everyone. I am Kaylin Harris, and I'm the multimedia brand designer here at Nashville General Hospital. We are very, very, very excited to hear all the amazing stories of our female physicians and providers. And then also, please feel free to ask any questions in the comment section of this Facebook Live posting, and I'll incorporate them into our roundtable discussion. So without further ado, let's begin. So Dr. Bullock, the first question is for you. So you have a dual role here as the Chief Medical Officer and the Emergency Department Medical Director. So what was your defining moment from going into emergency medicine and then administration?
Thanks, Kaylin, and thanks for having us tonight. Just want to wish all my female fellow physicians a happy National Women's Physicians Day. For me, it was to go into emergency medicine, really just, it was something that I did as a rotation. Really after about 2 or 3 days rotating in emergency medicine, realized it was just a good fit. And it's really nice to be able to see a myriad of different things, treat a number of different patients, and really at the end of the day, we're the front door of access for many patients that can't access care. And so it just was a really good fit for me, kind of a jack of all trades, if you will. And then converting into administration, I still like to keep my foot in the water of actually seeing patients, so I haven't jumped completely on the other side. But it was a slow, gradual process, obviously, and just holding different leadership roles throughout whatever different roles I had been in, all the way starting in residency as chief resident, and just taking on more and more responsibility in the role that I was currently in. And so that's how I kind of made the gradual transition into administration. Thank you, Kaylin.
No, thank you, Dr. Bullock. Thank you. Thank you for that answer. So I guess when we speak about, because especially when you talk about transition and going from the emergency department and going to administration, I do have a question about, for the entire panel, about work-life balance. Because I feel like, right now that's the biggest thing, especially with COVID-19 and the pandemic and the different struggles that people have had to overcome with that. So how do you ladies in your individual departments, how have you maintained a work-life balance, if you have? And that is open to anyone.
I'll start. Really, there's not a whole lot right now. Between 2 roles in COVID, there's not a whole lot of work-life balance. I think prior to COVID, there was much better balance, and it will wax and wane through your career, but you have to be able to put barriers around your protected time and really kind of take care of yourself. If you're not taking care of yourself and not taking care of your family, you're really not taking care of anybody. And so, it gets more difficult at times, and sometimes it gets a little bit better. But I think all of us struggle a little bit with work-life balance. I know at least two of the people on this Zoom have communicated that to me. But you have to figure out where you get the best relief and the best relaxation time to gather yourself back to be able to give back to your patients.
Well, I think it's very difficult. The work-life balance is difficult to begin with as a female physician. So there are a lot of different references that you can look at to sort of help you sort of balance your life. And so most of the time we put 90% work, 10% everything else. And so it makes it extremely difficult. So now they're teaching us to break it up and take breaks during the day and have some time for yourself, some peaceful time with your family. So they have you to portion off all of those different areas in your life now to try to help. But when COVID came, it was very, very difficult to do that. So I think COVID has put a lot of stress on physicians, especially female physicians. Now your children, if you have young children, they're at home now. So you're trying to manage with them at being at home as well as taking care of patients. So it's very difficult, I think, for most women. My child is grown, so I don't have that problem, but I know that women are having that problem because a lot of them have spoken to me about it.
Thank you, Dr. Faulkner. Thank you, Dr. Bullock. So the next question is for Dr. Davis. Dr. Davis, when did you know you wanted to be a doctor? And then in any point in time, was there ever a moment where you just felt like, this is too much? I kind of feel like this may not be the route for me.
I kind of always knew that I wanted to do, excuse me, something in the health sciences. Growing up, I was a very curious child. I was very interested in science. I was very interested in the human body and healthcare. And as I got older, I had more exposure to it. I was fortunate enough to be able to, shadow a couple of physicians that were, friends, neighbors of my family. So I got some exposure to it. And, you realize that, yes, you are, getting to do something you love and with science, but at the same time, you get to help people. It's just a perfect marriage of career choice for me, being able to do that. As far as, your question about, was there ever a time when I thought I can't do this? All the time when I was in medical school and residency, but you know that there's always tomorrow, and you just kind of get through the moment, get through the day, and you have these good, at least in my med school and residency, I had these very strong relationships with my fellow residents, my fellow students, and that really does help to get you through because you're all going through it together. You all understand how difficult it can be, and there's a light at the end of the tunnel. And I have no regrets about doing what I did, going to med school and doing family practice. I love it.
Thank you, Dr. Davis. Thank you. I feel like when you spoke about all the time, there are moments, especially I saw everyone else on the panel kind of giggle a little bit. So I think collectively everyone has had that moment. But we are definitely happy to have you. We are happy you did not, decide to become an astronaut or anything else.
I do have a question since you brought up residency. We see these TV shows like Grey's Anatomy. It's been out for a while. Is there any truth to those shows?
Yeah, there is. I mean, the parts where the attending physicians are, interrogating the students, and, that is real. Yeah, they try to, make you think on your feet. And it's tough, but we all get through it.
So my next question is for Dr. Faulkner. So Dr. Faulkner, you also have an extensive experience as a provider and in administration, having served as the dean of the School of Medicine and the senior vice president of health affairs. So did you ever have any mentors when you entered medical school or in choosing your specialty?
Well, women don't have a lot of mentors. And so they're mostly men that are in those areas. And when I started in nephrology, I think I was the first woman in the state of Tennessee to practice in nephrology. And so I didn't have any women mentors when I went into nephrology. So I worked under males. And I decided, I said, well, this is it for me, and I'm going into it. And I went into it, and it was the best thing I could have ever done. I love nephrology. So when I came back to the state of Tennessee, there were other women, but there were no African-American women. I think there were a couple other women in Nashville that practiced. And so we got a chance to talk sometimes, but mostly I was at Meharry Medical College practicing at Hubbard Hospital, which is now Nashville General Hospital. And so it has been a very rewarding and fulfilling experience practicing. But most of the time, even in administration, I didn't have any mentors that were in administration that were women. Most of them, just about all of them were men. So what I did was to strengthen that, I went and got a physician executive MBA at the University of Tennessee in 2006. And that really pushed me over the hill. And from that point on, I was zooming. So that's my plight.
Well, so that leads, and so you spoke about that you didn't really have any mentors when you were coming up. So now my question is, with not having any mentors, is it more so that you focus on being a mentor yourself to any students or any residents that are coming through?
Sure, I do. I'm a mentor to just about anybody. And I have a long list of people at my door all the time, except during this COVID time. But I do have a long list of people at my door all the time because I've been vice chair of a department of internal medicine. I've been a chair of department of internal medicine. I've been associate dean for graduate medical education. And then I've been the dean of the medical school. And I've been medical director of our practice plan. So I've had lots and lots of experience in leadership positions, and I've loved them all. But I enjoy going to another one all the time, though. But I just have a great time. As Dr. Bullock, we were working on something not too long ago where they asked my mentorship.
Well, see, okay, then that's really good to know, because I was going to ask the rest of the panel, do you all have any mentors or did you have any mentors when you were coming through, or do you have any mentees that you work with now? And what were those relationships like then, and how are those relationships now?
Thank you, Kelly. I don't have as much experience as Dr. Faulkner, but definitely I relate to the fact that growing up with societal pressure, most of my mentors throughout medical school actually were men. They were more of the male physicians in every aspect of the field. But I was thankful enough, Dr. Faulkner was one of my female mentors because I always, asked her questions throughout residency. And it was great to have, female figures to look out for or to look up to, just because it encourages you on the path of career that you're going to choose. And I'm so glad that I am in this field, and I look forward to furthering my studies. Thank you.
Thank you. Thank you very much. And the next question is actually for you, Dr. Long. So what challenges did you encounter, if any, while you were in college or in medical school? And then also, like, when you think about your class dynamics at the time, where they have male and female, did you see more male students that were coming through in your medical school journey?
Thank you so much. I went to University of Cincinnati College of Medicine, and I had gone to all Black high school, all Black college. So when I arrived to medical school as a minority, One of the challenges was, where do I fit in? But as someone spoke about earlier about being in the trenches with others, I found other females, African Americans, who I studied with. We traveled together still to this day. We chat on the phone together still to this day. So it was a little bit of a culture shock for me. I'm a Southern Belle, and so going to the North, it was challenges being away from home, being away from family, and everybody in medical school is smart. So where do you fall in that pathway of are you number one or are you number 160? And learning how to learn all the amount of information you need to learn in such a small period of time in medical school. But I had a great support system with my fellow classmates, the majority of whom were women. But believe it or not, we did have each class was a different dynamic, but my particular class, when I first started, was mostly African American women versus males. And so that was a little bit of a struggle in medical school. Residency, I came back home close to Tennessee, Jackson, Tennessee, and it's closer to my family, which was very helpful. And it was a small, intimate residency, and we all, again, became family really quickly. So that was really helpful for me in my transition from high school to college, to medical school, to residency. So I believe reaching out to others was very helpful for me. Having that sisterhood of sorts in medical school was very helpful for me. I don't think I could have made it without those girls. And I think that ultimately, when I did have challenges in school, I was surrounded by other people telling me, pick up your bootstraps, let's keep going. Like Dr. Davis said, may not want to do it today, but there will be another day. There'll be another tomorrow. So I was able to make it through. I did also have a mentor. When I realized that family medicine was for me, one of my rotations, I had this Caucasian doctor who was wonderful. She was awesome. And I said, I want to be you when I grow up. And still to this day, she's a mentor to me. We communicate on Facebook and social media. And that relationship to me has been very, very helpful. My first job out of residency, when I started, I saw a female physician, African American. She was in internal medicine, and I walked up to her in the physician lounge and said, "You're going to be my mentor." I'm a newbie doctor, and we found out that we actually went to the same medical school, and so she was very helpful for me as my first year attending, and still to this day we communicate. So I do definitely think that having a mentor was helpful. Having that sisterhood was helpful. And I try to also be a mentor as well. Anybody that wants to email me, I give out my personal cell phone number. And I'm always available because I don't think I could have made it without that support.
That is beautiful. That is beautiful. Thank you for sharing. And I think in that, two beautiful pieces of advice that you shared for people who are going through college or just life in general, medical school, is find your tribe. And then also communicate, stay in communication. I feel like right now with social media and different platforms at our fingertips, it's so easy, but sometimes difficult to stay in communication. So it's so nice to hear that you are still in constant communication with your mentors. But I do open up that question to the entire panel. Like, is there any advice that you would give someone who is currently going through medical school or is in a season in their life where they're like, okay, they're in that transition, between undergrad and okay, I'm about to make that jump to medical school?
Well, I would give them advice to say, go on and make that jump. I think that if that's what you want to do, because if you succeed, everything is great. If you fail, You won't know until you try it anyway. And so everybody didn't make it to medical school who was in college with me, but they tried. And so if you never try, you won't know if you're going to succeed. So I think that everyone should try whatever dream that they have, they should try for that dream. They should go for it.
Dr. Davis, you look like you were going to share something as well.
I was, thinking back to that time in my life when I was getting ready to start medical school and, how scary and uncertain it was. And, nothing can really prepare you for it. I used to call it boot camp because, you're just thrown into this world where everything is just moving so quickly. You've got to learn all this information so quickly, and it feels overwhelming. But I learned to just take a step back. Like I said, spend time with students in my class that are going through the same thing. And we would have study sessions, and sometimes the study sessions would turn into vent sessions, and and that was okay. But again, you always have to think about, this is not forever. There is a light at the end of the tunnel. And if you really want it, then you can do it. And just, if it's really what you want to do, stick with it because it's worth it.
Dr. Tammy Ford, were you going to share something as well?
So I was nodding to Dr. Davis because I was agreeing with all what she was saying. But yes, if I would like to say something is you have to build that courage not to give up. No matter the challenges that come your way, you have to try to stay dedicated and committed to the goal. I relate very much to what Dr. Davis said. Sometimes you want to drop everything else, but then you have to tell yourself it's worth it. You have to continue to work hard to where you want to be. And that's what I just wanted to add. Thanks.
Thank you. And I guess us keeping on the same tone about continuing throughout your journey. So what led all of you ladies into your individual disciplines? Like what led, like Dr. Long, you spoke a little bit about what led you to family medicine, but what was the mental space to decide, okay, I'm going to go into this specific area of medicine versus another? Dr. Long, I think you're breaking up just a little bit. I think maybe we should try to mute and then unmute one more time. Oh. Does anyone else want to share while Dr. Long, while we get the audio adjusted?
I will. I'm family practice, and when I first went to medical school, I thought I was going to be a psychiatrist, and I probably changed my choice of what I wanted to do, what I wanted to specialize in, probably 5 times. And I realized that I liked a little of everything, and family practice just ended up being the perfect choice because I could do a little bit of each specialty, and you can sort of choose to even subspecialize in family medicine if you want to. But, I really didn't make that decision until probably my 3rd year of medical school, after doing a bunch of different rotations and different specialties. And it was like, you know what, I can't decide. And family practice lets me do it all. So that's how I ended up there.
Thank you, Dr. Davis. Thank you.
Well, I can tell you how I got interested in nephrology. First, I started off in medical school, and in medical school, I just wanted to be a GP. I just wanted to do 1 year and go out and practice. And so then I realized that I had to do a residency, that they didn't have GPs anymore by the time I finished. So I did a residency in internal medicine. And then I said, that's all I'm going to do, residency in internal medicine. But we didn't have access to nephrologists very often. We had a part-time nephrologist on staff. So when I was on call at night, I used to have to read on everything in nephrology when I had a kidney patient. So I was so good that the other residents would call me at night and ask me to help them with their kidney patients. So I said, well, maybe I should go into kidney diseases. And that's how I got interested in it. And so I did a fellowship after residency. Because I had so much experience during the time I was in residency with kidney disease, I just decided to go into it.
And Dr. Faulkner, I have a question. What is a GP? For those of us that, may work in marketing or maybe not medicine and understand the lingo.
Okay. Long time ago, GP was a general practitioner. So
Okay.
they did a year of internship in a hospital, and then they went out to practice.
Okay, thank you. I appreciate that for myself and others that are like, okay, let me Google.
A younger generation.
Let me Google that really quickly.
Dr. Faulkner, you had mentioned earlier that your children are older. So were you having a family while you were in medical school or your residency, or did that wait?
Yes, no, I had a son when I was in when I was in residency. And so I didn't think I was going to have any children, really. And so when I became pregnant, I was like really surprised. So it was like doing my 3rd year residency. So it was very difficult because I was on call, and pregnant. But my husband was very supportive. And so if you have a supportive spouse, it really makes a big difference. And so we were able to get through it. And I was able to do fellowship, do public health. And so it turned out to be a very, very, very rewarding experience. But my son says I work too hard, so he is not going into medicine.
Oh, good. Oh, that's funny. Okay, that's a good segue. So have you ladies do you have any family members or any close friends? I know we spoke about the mentor-mentee relationship, but do you have anyone in your life that's like, okay, yes, I decided to go into medicine because of you, or yeah, I'm gonna maybe stray away from that area for now, but I'll think about it later. Have you guys experienced that as well?
Well, I have a second cousin who is in medical school right now, and he actually shadowed me in my previous practice when he was, trying to get into medical school. And I wrote a letter for him, and he's super smart. And he wanted to be an anesthesiologist. Well, now that he's further along, he wants to be a family practitioner. So I'm so happy that he ended up choosing that, and he'll be very good at it. But yeah, so I was very excited when he told me he was thinking about medical school. And now his, let's see, I'm not sure how they're related to me, but they're still in the same family. I guess they're his cousins and I don't know. Anyway, 2 of them, they're twins. They're both going to go to medical school. So yeah, but I was the first one in the family to go to medical school.
Oh my goodness. So that's a really great point. So you said that you were the first one in your family that decided to go to medical school. So again, like paving that trajectory and creating that foundation, that path. So I'm sure that brought on a lot of challenges in itself, but like good challenges being a first generation. Were any of you other ladies, did any of you experience that? Were you the first in your family, or do you come from a long line of doctors?
So for me, I was the first in my family, and actually the first female physician to be in my family. But I was so excited to learn that my younger cousin, he was pulled into medicine just because we've been talking to each other, and he felt motivated that that's the field that he wanted to do. I'm hopeful. well, I'm hopeful that my son does too, but he's like, Mommy, you're too busy all the time. He's 8 years old, but he's like, I'm not sure I want to do medicine. So.
Oh my goodness, that's funny. That's funny. So, well, Dr. Tamanfor, while we have you, we are very excited to have you on our panel as the current chief resident of internal medicine. So can you share with us your defining moment on becoming a doctor, and if you have any questions for the panel?
Sure, thank you. My defining moment, actually, when I was growing up, I was not sure what I wanted to do. I was trying to see if I wanted to be a teacher or wanted to be a physician. And my very defining moment was all the way in high school. I decided to do an away rotation with an internist. And he really motivated me that that's what I wanted to do. Because I saw the fact that he could help members in my community and he could contribute a lot towards providing health to them. And that was my very defining moment. Now, in terms of having a question for the panel, I have a question for Dr. Bullock. And my question to Dr. Bullock is, in your experience, I know you've gone through so many roles. Looking back, is this something that you would have want to consider, you would have thought of in your career?
It was something I would have considered doing differently, or something that I would consider doing going forward?
Something that you'd have considered doing different if that's the path that you had paved for this.
No, I mean, I don't think I would have done anything differently. I think that, you know, I am here and I've been through the experiences I've been through, and I'm not sure that I would be in the same situation had I not gone through some of the experiences. I've been grateful for every experience that I've had. And it's brought me to where I am today. And so, you know, we can always look back and say, are we going to change something? There's definitely nothing that I regret. But I think that, you know, as you look forward in your path, you just have to think about, where is this taking me, and balance, you know, what you're giving up in real time for what you hope to, I don't want to say hope to gain in the future, because you never know what you're really going to hope to gain. You just kind of follow what feels right. And I think that's always kind of been a little bit of my guiding light. If it doesn't feel good, you know, there's things that are uncomfortable, don't get me wrong. Things, sometimes being uncomfortable is a good feeling, but if deep within your heart, it does not feel right, then it's maybe something I don't necessarily pursue. But I tend to listen to myself a good bit, you know, and think through the decisions that I make. So no, there's nothing that I would have done differently at this point.
And then Dr. Tamanfor, I do have a quick question. So what is a chief resident? Do you care to explain?
Well, in my role as chief resident, we serve kind of like a liaison between an administration or leadership and the residents. We try to be their advocates. And we also continue to teach the residents as well as the medical students so that they can be able to foster in their career. So pretty much that's how I can summarize that.
No, you did it perfectly. So I guess, so what was your journey? So you're currently, if you don't mind to explain, so like, what is your journey? So you were in college, medical school, and then how do you become a chief resident? Like,
so my medical school was a 7-year program. So completed medical school, then moved to the US. And just completed residency at Meharry Medical College. And so based off of how you, so on your personal, so you look at your educational background and your personal background as well, and you try to see if you're fit for the position. And I was voted to that position. So I thought it was a great opportunity for me to help the future generation in this career, especially continuing to empower women.
Interestingly enough, we have another chief resident on our panel who is currently the chief medical officer. So Dr. Bullock, did you have, for emergency, were you chief of emergency medicine, that residency, or was it over the whole hospital?
No, it was for my residency program. And so it was my last year. And sometimes you're appointed, sometimes you're voted, sometimes it's a combination of one versus the other. And those positions, they can be, depending on the residency program, they can be very different. Sometimes it's an extra year added on, sometimes it's your final year of residency. But with that being said, you really are responsible for what goes on in the residency program and all your residents below you. Some of them we have an administrative chief and a clinical chief. So it just really depends on how they split it up. But it's definitely it's a great learning experience. It's a great experience in leadership, with still having some, somebody to always reach back out to, being your program directors and administrators to still, kind of guide you along the way. But at the same time, you are responsible for quite a bit. So definitely a great experience. And I think, wasn't Dr. Faulkner a chief too?
Yes, but during the time that I was chief, we split it up amongst the third year residents. And so, like you said, sometimes there's an extra year, sometimes not. And in the year that I was chief, we split it amongst the 5 residents that were third year residents. And so we were responsible for making sure we had journal club, the schedules for all the residents, making sure that they were in, they came on time, they did their jobs. So we were responsible for making sure that the residency program ran like it should. It was exciting, it was fun, but I don't think I would have wanted to stay and do a 4th year. That was hard work, and I'm a short person in height.
So I know I've been asking a few of the panelists what was that defining moment, but what is something that you all in the last 5 years, a piece of advice or something that you've learned about not only just yourself, but in your discipline, that you would like to share?
Well, I would like to share that doctors are always hard to manage. Doctors are like cats. They're all over the place. Because like one of the panelists said, doctors are very smart. And so in order for a doctor to be managed, you have to be really, really, really on top of things. And so doctors are taught that they're at the top and that the buck stops with them. And so as an individual, so when you're in a group, it's sort of hard to manage that type of group. It's very difficult. So I applaud Dr. Bullock because she has a hard time. I've been down that road. I don't want to go down that road again.
And you didn't just learn that in the last 5 years. I guarantee you that.
And I wish the others well who planning to go down that road as well. But it's a very difficult road to go down. And I think that doctors are going to have to work together in order to be successful in this time, because things have changed. Where we used to be individual, doctors could go out and open up a practice, do very well. But now you can't do that. You have to go into a group. And so you have to work with somebody, and somebody has to be your boss. And so doctors have a very difficult time adjusting to that. So I think the doctors coming in, though, have a different perspective of medicine, and they don't want to work as hard, like be on call every day, every hour, every minute, every weekend. And so I think that doctors are having a different feel for medicine and how to work around the difficulty is practicing medicine and having more of a life balance. So that is good. And in that, they're learning how to work under somebody, that there is a boss. And so I think things are changing in the field of medicine. I think it's becoming more adaptive to a regular lifestyle. And I think more women will be more interested in getting in medicine, knowing that this is occurring.
Can you hear me? Okay. So I would completely agree. In the last 5 years, because like Dr. Davis said,
We chose family medicine because we absolutely love what we do. And in the last 5 years, I've had to put boundaries on that work-life balance because if given to my own accord, I probably would work 24 hours and give my all every day. However, mentally, physically, one can't maintain that. So in the last 5 years, I would say I've been hunkering down on how do I maintain that work-life balance and how can I be the best physician for my patients, but also be present at home with my family so that I still have ability to be present with my family and not charting, not working, not resting, sleeping. So in the last 5 years, I would definitely say learning how to have that boundary work-life balance, as well as learning how to separate what do I do for fun? What do I do when I need to de-stress? And learning how to work with others. Doctors can sometimes be challenging to work with. Our personalities are shall we say, we want to be the best at what we do. Otherwise, we wouldn't do this job. So it sometimes comes across as, a little bit of, it comes across as it comes across for some people. But in the last 5 years, I'd say definitely working on that work-life balance, being able to be 100% at work and love this job, but not let this job be a hindrance to my mental health and my physical health.
Another thing I'd like to add, women physicians, I believe more so than men, not to say men are bad physicians, that's not what I'm saying, but women physicians tend to have sort of a mama bear approach to their patients. They are very passionate and very, they want to make sure that their patients are well taken care of. They worry about their patients. We take our patients' problems home with us sometimes because, if there's a patient of mine that's, having a difficult time, or they're in the hospital, or, whatever, I worry about them, and so that can take a toll on us as well, because we can't help it. We worry about our patients just like we might worry about, family members, and sometimes patients are kind of like a family member. I have patients that have been coming to see me for 20 plus years, almost my entire career. And, you get to know, and this is of course family practice, you get to know these patients very well, and they are like your family. And when, they get COVID, or, their husband has a heart attack, you worry about them, and that can take a toll as well. So that's that. I believe that is more so for women physicians. That's just kind of their natural instinct.
And I am monitoring chat, and we have 2 questions that have come in through Facebook Live. So the first question is to the entire panel, or anyone that wants to speak specifically on this. So how has your role as females, or as women in white coats in medicine, how has it been? Like, how your current role, how has that been for you? And then when you answer, do you mind sharing how many years you have been in that role or been in medicine? See, no one wants to share how many years they've been in medicine. Oh, okay. See, I'm just going to kick it to Dr. Bullock, and I'm just going to call everyone out at this point.
I knew you were coming this way. So read the question again, because you kind of lost me towards the end.
So Beverly Brown just asked, like, how has your role as a female in medicine been holistically, in the years that you've been in this particular industry, and how many years of service do you currently have?
So I am coming up on 20 years, but I will say overall, my journey has been amazing. I'm very happy to share this panel with, you one of my mentors sitting right there, and Dr. Faulkner. You you have a group of people around you, and whether that started before medical school, I've had a very supportive family. I've had a very supportive group of friends throughout undergrad. My very best friends are my group of same girls from med school. We met day one and they were my study partners. And even to this day, you know, I got a text this morning saying, you know, we all made it here and, you know, we made it on this journey because of each other. And that really is the truth. And so I've had an amazingly supportive residency program. I've been at Nashville General back now 15 years. And the entire team has been great in supporting me. Have a great group of providers that work with me. And so I think that's made all the difference for me.
Thank you, Dr. Bullock. Dr. Tamfor?
Yeah, so for me, I've been 10 years as a physician, and it's been a wonderful and a great learning experience at every step of the way, especially during residency. In my role as chief resident, because I'm a fourth year chief resident, I've just been in for 1 year. It's been awesome. I had considered taking this position to continue to teach the other medical students so that they should, you know, see like a better version of medicine. And I don't regret it at all. It's been a great experience with a lot of support from my family, from my residents, from my co-residents, and from the faculty at the program. And it's something that I will not regret at all.
Thank you, ladies. And we have one more question from Bianca Lachey. So you all mentioned how physicians can be difficult to work with at times. Everyone has voiced that in some shape, form, or fashion throughout this entire panel. So she asks, what advice would you give to female nurses who seek to what advice would you give to female nurses who seek to be in administration and work closely with physicians?
I would say don't see them as physicians, see them as people. I think if you start out by treating everybody as people and understanding where people are coming from, and just listen, I think that you can develop that skill set and also those relationships that matter. I think a lot of times we go into rooms and conversations, you know, a little intimidated by titles and degrees and things like that. And I think at the end of the day, I mean, yes, there's a little bit of, you know, respect that you have to show people given certain positions, but at the same time, you know, we need to learn to listen to people and not just always hear people to speak back, you know, listen to what they're saying and understand where they're coming from. And I think that at the end of the day, you know, is really important. And that's in any role. It doesn't matter if it's a nurse or a physician or an operations person and a nurse. It really doesn't matter. And I think you'll find your strongest relationships and your strongest bonds and the ability to get things done when you go at things together for the same end goals.
Thank you, Dr. Bullock. Thank you. And we have one more question from Doria Gibbons. So what long-term goals have each of you set for yourself? And we are going to start with Dr. Davis.
Wow. Retirement. I mean, I've, you know, back to your previous question, I've been doing this now for 23 years. And I'm at that point in my career where I'm kind of looking towards, you know, the retirement part of it. So, but as far as, you know, goals in the position I'm at now, I mean, I really care about the organization. I'm really, you know, I love that I'm here, and, you know, I want our office to succeed. You know, I'm at Nashville Healthcare Center, which is separate from Nashville General Hospital. And we've been there almost 3 years now. And, you know, things are looking up. Things are getting better and better. And At this point, my goal is just to make our office the best it can be. I honestly don't have any better thing to say than that. I'm sorry.
No, that was perfect. Dr. Faulkner?
Well, I'm very close to retirement, so my goals are very short at this point. But early in my career, I did work towards retirement as I sort of sectioned off my income. I put some for retirement, some for pleasure, some for daily living. And so I think that every physician should plan for retirement, because you would hate to retire sort of broke, because you already have a high lifestyle. And so you want to make sure that you have enough to sustain that lifestyle during retirement. And so I think that in the time that you're working, prepare for retirement. Do not spend all your money up front. I know it sounds good to go on those $10,000 vacations every year, but please save $5,000 of that for when you retire. So I think that was my goal, to make sure that I had enough for retirement when I was stepping out of medicine.
Dr. Tamerford or Dr. Long, do you have any long-term goals that you'd like to share?
I'll get it. So, I have not thought about retirement, Dr. Faulkner, but I know she's giving us a lot of lectures and thinking about retirement. My goal right now is to continue to serve as much as I can, and looking forward to fellowship. Hopefully I can get a match. So that's my long-term goal for now, but I think I should start thinking about retirement as well.
You're never too young to start thinking about retirement. But I've been practicing probably in the middle of everybody. I'm not the baby, but not 20 years. I'm more 13, 15 years. And so I still have a lot to give, a lot to offer. I love my patients. And even if I do retire, I'll probably still be working, whether that's, part-time or some capacity. I don't think I could walk away from this job at all, just because I love doing it. I think 5-year plan would be, like Dr. Davis said, continuing to make our office the best office as it can be, bringing a service to North Nashville, to our community. Every day I see patients still that have been overlooked for multiple reasons. And so I have a drive that nobody can really burn out at this point, because I feel very mama bearish for my patients. If nobody's going to be listening to them, I will be, and being their advocate as best I can. So my 5-year plan is to continue to grow this place. I'd love to do more in the community, so that life balance is important, so that I can actually get out in the community and do more, wellness center, and all of these things that are necessary in our community. So just 5-year plan, seeing where we can grow, where can we be, with the healthcare center on Charlotte, and continuing to work alongside everyone on this panel and at Nashville General to make Nashville General better, to not necessarily better, but just so that we take good care of our patients, continuing to do that.
And Dr. Bullock.
So obviously, for the next 5 years, my goals are just to continue being able to have the best effect I can on the most amount of patients, whatever role that is in. Sometimes it's not directly patient, meet of patients, but maybe it's providing the vehicle for other people that I work with, and making their path to be able to affect patients easier, and also serving as a mentor and a role model for all those that come behind me. So those are really my 2 biggest goals for the next 5 years. Not really sure how that ties into different roles, but I think those will still be the two guiding principles behind what I do for the next 5 to 10 years.
Well, that is all the time that we have. First and foremost, I would like to say thank you to everyone that not only joined in, but I would also like to thank everyone that is on our panel tonight, especially, of course, our women in white coats, Dr. Bullock, Dr. Davis, Dr. Faulkner, Dr. Long, and Dr. Tammy Ford. Thank you so much for taking the time out to speak to everyone and share your advice, or just share some things that you've learned along the way, and just where you are now and where you see yourself in the next 5+ years. We really appreciate it.
Yes, thank you all for being
Thank
here.
you.
Thank you.
Thank you.
Thank you.
Anybody who has a question, if they're still typing them in there, we'll make sure to answer them and send it back to the physicians here on the panel for feedback. Also, if anyone would like to learn more about Nashville General Hospital, please visit our website at nashvillegeneral.org. You can also find Kaylin and I on our Facebook Live Wellness Wednesday events twice a month. Join us next Wednesday, February 9th at 12:15. We will have Dr. Henry Okaffer, our Chief of Cardiology, as February is Heart Month. Thank you again.
Have a great night, everyone. Thank you for joining in.
Good night.
Thank you.